Hello, everybody. Welcome to Therapy Tales. This is a place where we discuss therapy, everything that goes into therapy. Therapy is for everyone. Now, honestly, if you haven't come to therapy, how are you managing life? We ignite our emotional experiences based on where we were emotionally hurt, where there was an emotional psychological wound, and that is what trauma is. If you don't process your trauma, it is stored in the body as grief. Trauma causes a loss, and a loss brings about grief. So what is therapy, and what should you look out for, and what should you not look out for? So this is episode 1, and I'll be taking you through what therapy is, what it's not, and some very crazy stories about therapy. So welcome. My name is Nyambura Gadombe. I've been a therapist since 2017, and I love what I do. So what is therapy? Imagine therapy isn't just for people who are going through difficulties or for people who are going through issues. Therapy is for everyone. Now, honestly, if you haven't come to therapy, how are you managing life? How are you managing all these stressors that are going on through life? Therapy is a very powerful experience that helps you understand your resources. It helps you understand your skills. But anyway, I'm going too forward. So what is therapy, and what should you look out for, and what should you not look out for? And maybe even before I go into the formalities, let me just tell you about a story of someone I know. I won't say if it's a client or not. I won't say if it's me or it's a friend. We always have that experience. Imagine the person went to therapy and sitting down with this therapist, they're listening to them, they're taking notes, they're asking them questions, and the person is opening up and they're saying, hey, this is what I'm struggling with. Silali, sikuli, I'm finding that I'm drinking too much. And after that, the therapist puts the book aside and they're like, I think shida yako ni ati ujiamini, guys. That's not what therapy is. Like, run. So what is therapy? So one, understand that therapy is a scientific process. And by scientific process, I mean, we use a lot of evidence-based research to help clients get through difficulties or grow. How does this look like? When a client comes into my therapy room, which I am in right now, this is my office, and you're welcome. When a client comes into therapy, the first thing that I want to do with my clients is to make them feel safe. I've had so many of my clients, and I've been a therapist since 2017. I've had so many of my clients come in and say, I don't know what it is about this room, but every time I sit down, I just feel like it's a warm hug. And ideally, that's the first step to therapy. You want to feel like you're loved without being told I love you. You want to feel like you're accepted without being told I accept you. So that's the first thing. The second thing is professionalism. I always tell this to my clients. Please ask your therapist to show you her or his qualifications. Wakianza kukua defensive, just know there's an issue there. So you want to have a therapist who is professionally trained. Now, I don't think it's right to say, go for a therapist who has an MA or whatever. No, that's not my portion. Even if your therapist or your counselor has a diploma or a certificate, as long as they are professionally trained, just know that you're in the safe hands. And ask for that documentation. Ask to see that certificate. Don't take people's words. In therapy, we say you trust, but you verify. So you trust that you're dealing with a professional, but you verify based on their qualifications. That's number 2. And also, by the way, guys, just FYI, there is a board called Kenya Counselors and Psychologists Board in Kenya that is established under the Ministry of Health. And their work is to actually regulate and make sure that anybody who calls themselves a psychologist or a psychotherapist has the appropriate qualifications. So if you're dealing with a therapist, they must be registered under the Kenya Counselor Psychologist Board, and there's a registered certificate for that. So ask for that as well. That's number 3. Number 4, ethics. Ethics means everything that is discussed in the therapy room is confidential. Actually, you don't want your therapy to come on a podcast like this and say, hey, last week I had this client. Hey, manzi alikuwa messed up. Yani aliingia tu hivi niko like, what am I gonna tell them? Ethics has to do with preservation of life. And above preservation of life, it has to do with quality, improving the quality of your client's life. And ethics also encompass confidentiality. So everything a therapist discusses with a client is confidential. And that's the reason why therapy is so impactful, is because it's one of the areas, apart from prayer, it's one of the areas that a person can come with a professional therapist and explore what is happening internally for them. And finally, and this is so, so important, in therapy, you have to set goals, and these goals must be measurable and achievable, and you have to be shown the framework of how those goals look like. Therapy si kuongea tu, you're just, ukuji tupige story. Yes, you're coming to talk, but I need to help you move from this area that you've come in and you go into another area, and that's how goals are set. So that's everything about therapy. How did I myself get into therapy as a therapist? I grew up quite in a very tumultuous situation. I'm sure many of you have heard my story or listened to amongst other podcasts that I've been in. I was brought up by my dad alone. Amazing man. Unfortunately, he passed on like 2.5 months ago, and it's just been devastating. Thank God we don't look like our grief. And my dad bringing me up, I really missed my mom. So my mom left when I was 2 years, and just that tumultuous experience of growing up in such a heavy, harsh environment, I grew up saying, I never ever want another child to go through what I've gone through. So I went into school wanting to do child therapy. I started my schooling at University of Nairobi. So I did a BA in counseling psychology, which I really, really loved. And then when I was doing my schooling, I realized, hey, these children cases are too heavy. I can't handle. So then now I morphed into seeing individuals, into seeing couples, into seeing families, and I have a few organizations that I also take through. When I say I couldn't handle cases for children, I actually don't see children below the age of 10. And it's because I become more than a therapist. I become the judge, the jury, the executioner, the policeman, the DCI, all those things. And that's not objective to the child. So when I finished my BA in counseling psychology, I went ahead. I did master's in marriage and family therapy at USIU. And that's how I became a therapist. And my goal is to actually ensure that each and every client that I come into contact with, they benefit not only from the science that I'm sharing with them, but from the emotional connection between me and my client. And now that's therapy. So what do people talk about in therapy? We literally talk about everything. We talk about couple relationship, communication style. We talk about faith. We talk about sex. We talk about identity. We talk about lack of identity. We literally talk about everything in therapy. But I want to focus on something that I actually work on, and it's a triad. It looks like a triangle, EIK triangle. But anyway, so it's trauma, grief, and shame. I've been a therapist since 2017, full-time therapist since 2021, I think, 2022 Apple. There's not a single person who comes into session who does not have or has not experienced trauma, grief, and shame. So what is trauma? Trauma is anything that leads you to a traumatic experience. And as you can tell, that's not such a good definition, right? So we normally say that trauma is an event that causes an emotional experience. Have you ever gotten yourself in patterns where you either come from one unhealthy relationship, you get into another unhealthy relationship, you get into another unhealthy relationship. You're like, kwani ni mimi? Am I the drama? What the hell? Am I the drama? You be the judge of that. I don't know. But anyway, the whole idea is we ignite our emotional experiences based on where we were emotionally hurt, where there was an emotional psychological wound. And that is what trauma is. Once again, just to help you understand, trauma is an event that causes an emotional experience. And how do you know that you have trauma? One of the big telltale signs is you find yourself in patterns that you had sworn you'd never be in. patterns that you consistently find yourself doing and you can't help yourself. There's an emotional experience that's going on. Fact number 1, trauma keeps us stuck. What does that mean? At the psychological wound where you experienced your traumatic event, that is where you have emotionally regressed. In English, please. So, for example, one of the biggest traumas that I've encountered is emotional neglect in children. So, if a child, so let me use myself as an example. Because I was emotionally neglected by my mom, my maternal caregiver, at the age of 2, I was emotionally stuck at the age of 2. So that if there was anything that was triggering me emotionally, physically and behaviorally, from the emotional part, I behaved like a 2-year-old. And that's why in couple relationship, we find people behaving like quote unquote children. Amenijamia, aniongeleshi, silent treatment, the amenifuria. It's because of the emotional trauma, the emotional event, the trauma event that happened to you emotionally. It gets you emotionally stuck. So that's fact number 1. Trauma gets us stuck. Fact number 2, if you don't process your trauma, it is stored in the body as grief. Remember that triangle I shared earlier, trauma, grief, and shame. Trauma causes a loss, and a loss brings about grief. So grief is stuck in the body if grief is not processed. The most influential people in my career is somebody called Dr. Bessel van der Kolk. He's written the book, The Body Keeps the Score. In that book, he shows how trauma, because it's experienced by the body, if you don't release the grief gets stuck in the body, and that becomes the emotional experience from the traumatic event. So much so that another pioneer in our field, he's called Dr. Gabor Mate, has done a lot of scientific information to link certain traumas, certain childhood experiences with diseases like breast cancer or cervical cancer. There's a lot of science now showing that the arthritis, high blood pressure, and insulin imbalance can actually be caused by some early traumatic experiences. If you don't process your trauma, it's stored in your body. Higher. Fact number 3, trauma causes shame. When something happens to you when you're young and you don't understand what is going on, you blame yourself and you start to think that there's something wrong with me internally, and that's how shame comes into place. So when you come into therapy, we process trauma, and as we process trauma, we are dealing with the grief, and we are also dealing with regulation of shame. Tuko pamoja? I hope the class is not so boring, but anyway, let's carry on. So how does somebody who's healed from trauma look like? The common mantra, the common denominator is we're not looking for a perfect person. There's no perfect person. We are looking for somebody who is aware of their anxiety levels, but doesn't let the anxiety levels cripple their experiences. So you're aware of your anxiety level, but your anxiety level is not crippling your emotional experience. And that's how healing looks like. Alafu guys, by the way, healing is a lifelong journey. Mtu asiwadanganye, you'll come to therapy for 3 sessions, alafu you'll be healed and you'll be okay, and now you'll be a sensei for relationships and nobody will ever hurt you again. No. Healing is a lifelong journey because healing has a component of relearning as we are unlearning some of the things that have caused us trauma. So we've discussed what to look out for in therapy. We've discussed we haven't discussed red flags. I'm coming to that as we slowly wind down. We've discussed what trauma is. We've looked at how trauma, shame, and grief intersect, some science behind it. Now, what are some of the red flags in therapy? Imagine, ujalala the whole night. Kuna anxiety, ujalala huku kula, boyfriend or partner anakustress, kazi inakustress. Then you're like, you know what? I think I need therapy. Then you go on Google ama ChatGPT, sijui ni gani zinatumika siku hizi, you check therapist near me, and then unapata jina. Then you call and say, hi, I want to come for a therapy session. How much is it? How long will it take? How many sessions do I need? So you've put in the effort. Alafu unaingia therapy room and you just feel that feeling of I'm not sure. Please be aware of that because it's your gut telling you something. Anyway, then unakaa chini, and then ukikaa chini therapist unajiintroduce, alafu sasa therapist anaanza kukwambia, hey, these are my qualifications, this was what I did. And then you talk a little bit about what has brought you into session. You say, I'm stressed. My relationship isn't going so well. Work is stressing me out. My parents, financially, niko stretched. And then therapist nakwambia, hata ujui, wacha nikwambie. Mimi last week, nilikuwa na stress. Lakini unaona hii kazi yangu unasaidia sana. Alafu, red flag. Imagine just wake up and leave. Na usilipe because that's not a professional therapist. A therapist will never hijack your therapy session. They will never they should never compare their experience with you. Granted, there's something called self-disclosure. Self-disclosure looks like this. A client comes in and they say, I'm very stressed. I don't know what to do financially. And the client looks at you. As a therapist, we are very intuitive. And you look at the client and you say, you know what? That's actually really normal because I do struggle with that as well. That's self-disclosure. If the client says, could you expound more? Then you expound more. And sometimes you can't. This is how I struggle. I'm also trying, financially I'm stretched and all that stuff. But there is hope you can overcome that. Not ile ya, wewe hata ujui, wacha tu nikwambie. Mi sasa mi ndio therapist, wacha nikwambie sasa, wewe ndio ujui. Those are some of the red flags that you need to look out for. Guys, we have come to the end of episode 1. Thank you so much for staying in. I hope it's been impactful. My number's down there. My email address is down there if you want to reach out. And let's see you again in episode 2. And we'll delve deeper into some of the questions that my clients come into therapy with. Or some of them have even shared with me on IG. So I'll be answering a lot of questions just to help you understand what therapy is. So feel free to ask your questions and thank you so much.